This conference will now be recorded.
Good morning, everyone. Thanks for joining us here. This is Melissa Morin. I'm one of the public information officers for the Whatcom County Health Department. We're going to hear today from Erica Lattenbach, Whatcom County Health Department Director. Before we get started, just a few reminders for folks. We will have a Q&A after we've heard remarks from Erica. Currently, the chat feature is disabled, but we'll open that up after her remarks. Members of the media are invited to type their name and affiliation into the chat feature, and we'll call on folks in order as the questions come up in the chat. As a reminder, this is being recorded and will be available later this afternoon. It's available in 2 spots, on the Whatcom County Government YouTube channel, and we also post this on the Health Department's COVID page at www.whatcomcounty.us/COVID. And from there, you can navigate to the page where these briefings live. Also, please remember to mute yourself. And with that, I'm going to turn it over to Erica to share with us today.
Good morning, everyone. Thanks for joining us. Again, I'm Erica Lattenbach, the Director of the Whatcom County Health Department. I want to talk about a couple of issues and things that... Oh, could someone mute themselves? It just sounded like I heard some talking. Thanks. I want to talk about a couple of issues and some kind of hot topics that we've been getting a lot of questions about. First, masks and the recent modeling that we've been doing around masks and mask wearing. And then I want to talk about testing, and I'd like to talk a bit about our metrics and where we are on our metrics and what we're seeing in the community in terms of spread and demographics and other information that we're finding. So I want to start just briefly. We sent out a news flash earlier this week about the use of masks, and the first graph had to do with what we're currently seeing in Whatcom County, which is about a 46%. And again, this is an estimate, a 46% adherence to mask wearing. And our modeling folks, who are a combination of our data folks at the Whatcom County Health Department, as well as partners with epidemiologists at Western Washington University, they ran a model of what it would look like in our county in terms of cases if we went from 46% adherence to 80% adherence. And the modeling looks dramatically different in these 2 scenarios. And I just want to clarify that the results of the models don't necessarily predict absolute infections in the future, but they demonstrate certainly and highlight what other model simulations and analysis are concluding, and what we're learning all over the country, which is mask use can and does slow the spread of transmission in our community. So with that, I just want to clarify that, and it is pretty dramatic to see the differences, and it's no secret we have been pushing the use of masks for months now, and we do believe that they are an effective tool. We only have a few tools available to us without effective treatments or a vaccine, and those are masking, physical distancing, hand washing, hygiene measures, and that's about all we have. So if we use those tools, the only tools we have, we can see slower rates of disease spread. If we don't use those tools, we're really limited in our ability to control the spread of this virus in our community. So next, I want to talk a little bit about testing, and I think there have been a lot of questions about our testing capacity in Whatcom County, and concerns about the number of tests, etc. And we had a meeting with our healthcare providers, and I think it's important to frame these questions around what we heard from one of our providers was, can you please clear up the myth that there isn't testing in our community? And the last week we have done some analysis, because this is a coordinating role for the health department, but the health department does not do in general clinical practice, and testing is a clinical function that we rely on our healthcare partners to help with and to staff for and to make sure patients have access to. So we've been working with our healthcare providers for months on this. And there's a few things in our analysis over the last week, just kind of getting the lay of the land of what is actually happening with testing and what the capacity is. We have, if you could mute your phone, I'm hearing a little feedback again, thanks. We have found that there are 11 different providers that are doing testing work, and this is also on our website. There's some new. So the health department continues to do testing under our health officer's standing order, and I can describe a little bit of the process as well, but we do testing. We also refer folks and screen them and refer them to Northwest Labs. So obviously Northwest Labs is doing testing. Peace Health is doing testing at 2 different sites, Cordata and at their medical center. Family Care Network is testing. Western Washington Student Health Center is testing. There are 2 urgent care clinics, Care Medical and SuperTrack, that are doing testing. 2 tribal clinics, both Lummi and Nooksack, are doing testing, and 2 federally qualified health centers that are doing testing, which are CMAR and Unity Care. Based on our analysis and in talking with healthcare providers, we have found that those that have consistent testing have the capacity to test 2,558 people per week. And that does not include the health department, because we are kind of on demand. We do rapid testing at different sites, and we also do that screening. It doesn't include Unity Care, because their staffing and their numbers are based on scheduled appointments, so that can vary from week to week. That doesn't include Nooksack and Lummi, who also do this work, that have not yet provided us with numbers, but we expect will. It doesn't include, sorry, there's one other one, and it doesn't include SuperTrack Urgent Care, who we haven't received numbers yet. So our baseline level, which once we have more information and get responses back from all of our providers, our baseline level that we know of is 2,558 people per week, which is by any standard a robust testing capacity. We also have the ability, because of Northwest Labs, to be able to process those tests very rapidly and at a very high volume. And so in terms of testing volume and capacity, there are not issues there. And I will describe just very briefly what the process is for folks. If they are identified through our case and contact investigations as a close contact of a known case, or if they have symptoms and we haven't identified them in that way, they can call the health department, and through our health officer's standing order, we have nurse consults that work with these patients, that do a bit of screening, do some intake, do an evaluation, and they're able to send that directly, and this is at no cost to anyone. They're able to send that directly to Northwest Labs and be able to get people in for testing within 24 hours. We have an arrangement with Northwest Labs. They've been a great partner in that way. So that is one option, and that is free. That is free because the consult is free from the health department. The test is free whether you have insurance or not. If you have insurance, our state health insurance commissioner has required that all health insurance providers waive the fees, the co-pays, the deductibles, etc., for getting a COVID test. If you do not have health insurance, medical providers are set up through a grant from the federal agency HRSA, Health Resources and Services Administration within the HHS, to be able to be reimbursed for testing fees. So whether you have insurance or not, you can get tested and go through the process for free within 24 hours. If you want to go visit your doctor instead of going to the health department, you can make a phone call to your doctor and they can do a telehealth visit, which is really straightforward and easy, and they then can order the test for you. We also, folks that we have that come to the health department and call our nurse consult line, we do also recommend that they talked with their primary care provider if they have one, or to try to connect them with a primary care provider, because we want to make sure through this process, and this is part of the telehealth, the importance of these telehealth visits and these assessments. We want to make sure that people with severe symptoms are connected with resources or are referred to the hospital. We also want to make sure that there's follow-up available, that the doctor knows, their primary care physician knows that they've been tested, and if there are confounding health conditions, that they're able to track and monitor those as well. So this is a clinical function. It's still important for the relationship between the patient and their provider to monitor symptoms, to ensure that they have the resources and medical care needed and available to them. And it's a pretty simple process, frankly, especially if folks go to the health department. It's a very simple process. So there are a few things there. Obviously, there's testing volume and capacity. There are easy ways for people to get tested, and we've also heard loud and clear from Care Medical that if there are employers that would like to test all of their staff, they're able to make that arrangement through Care Medical to do something like that. So that's a bit about the state of testing in our community, and we do recognize that that there are still some barriers. It's not a perfect process, and we are working to try to increase the number of hours available to make sure that that providers have resources that they need, that we have geographic diversity in testing opportunities for folks, and we're talking with partners about the potential for opening additional drive-through options, and using our first responder volunteers, working with our Whatcom Unified, and this work is ongoing. We are preparing not just now, but also for the future. If there is a surge in testing needs, that we will be prepared for that. But at this point, we do have testing volume and capacity in Whatcom County. The last thing I want to share is a little bit of information about what we're hearing regarding the most recent cases in our community. First, and many of you know this if you've been tracking the case counts each day, that we clearly exceeds the four cases per day. And at this point, our average cases per day is 11.6 as of 2 days ago, when that reported last. Whatcom County continues to have higher rates per 1,000 cases in comparison to neighboring counties. We have a higher percentage of cases in Whatcom residents under 30 years old, and we talked about this. I've talked about this a number of different times about the change and the shift in the demographic, the age demographic of what we're seeing. And in fact, in the last 2 weeks, we've actually seen an increase in cases among those 0 to 19 years old as well. We do recognize that certain communities across Whatcom County continue to see a higher rate of cases per 100,000, and primarily that's in North County. And since the beginning of June, there have been about 20 outbreaks that meet the Department of Health definition of an outbreak, which is 2 or more within a 2-week period at an employer, or in a congregate living facility, 1 case is considered an outbreak. And there are 57 cases associated to the recent outbreaks and 31 probable cases. So as I have talked about a number of different times, we are seeing through social events that both the rate of cases is going up, but also the number of contacts associated with each of these cases. There could be people who have 20 to 30 close contacts over their infectious period. And that is both a function of the social events that could have many, many exposures. And it's also a function of more mild symptoms. So people going to work or going to friends' houses or family, other social activities while they're sick or pre-symptomatic. And it's also a function of more businesses being open and more people back at work and bringing that into the workplace, or bringing it as they frequent different businesses. So our work is cut out for us as case and contact investigators at the health department. Just today, I learned that we are making daily contact with 288 people today, and we have 39 new case investigations and new contact investigations to conduct today, which can take up to an hour each. So there's a high volume of work, especially because there are so many contacts associated with a lot of these cases. So we've brought in 8 volunteers and 4 interns, and we're screening for more volunteers now to help us do this work. We've been really lucky to have a high caliber of people who are medical professionals that are retired. We have a med student that's working as a volunteer for us, and people who really have a good sense of this work and are able to help in a very professional way. So that has been a great addition to our team, and we're continuing to build our resources so we can continue to respond to this. We recognize that that all of these things are interlinked. Testing is important, but testing alone without these case and contact investigations does not slow the spread of this disease. And testing and case and contact investigations also do not slow the spread of this disease unless people are monitored in their isolation and quarantine, which we are also doing. I mentioned that we are doing daily monitoring to make sure that people have the resources available to be able to successfully isolate and quarantine, whether that means that we line up community resources like food, rental assistance, even purchasing diapers and other essential needs for families so they can maintain successful isolation and quarantine. So this is a multi-pronged approach to addressing this disease. Each one of these is important, and as we say in public health, necessary but not sufficient. And this whole system is working, and we're able to meet the current demands and planning for the future as well, along with our partners and with Whatcom Unified Command. So with that, I think I'll take questions.
Thanks, Erica. We've opened up the chat feature. So again, we're inviting members of the media to type in your name and affiliation, and we will call on you to unmute yourself and ask your question as those begin to roll in. Looks like our first question is from Robert Mittendorf with the Bellingham Herald. Robert, go ahead and unmute yourself and ask your question.
Hi, Erica. Thanks for taking questions today.
Yeah.
Um, I actually have a couple, three questions related to masking, and I'm wondering if I can ask those all at once.
I don't see anything wrong with that. No, go ahead.
Thank you. Can you say again who developed those models that are at the website right now?
Yes, that's the modeling work we've been doing since April. It's a team of 3 Western Washington professors, as well as our health information and assessment professionals at the Whatcom County Health Department.
Okay, great. Thanks. When you talked about the 46% mask use, is that countywide, and how did they get that estimate?
You know, I'd have to look back at their methodology, and we're happy to send that to you.
Okay. So related to that, how is compliance going in the workplace, and especially in retail settings where, the public people might, retail and restaurant, places people might be going or congregating indoors?
Yeah, we don't receive complaints directly. Those go
Hmm.
directly to the state.
Yeah,
So
okay.
we aren't always aware of where there are issues. I will say, and I'm actually really excited about this effort. As you may remember, we stood up a task force on employer support, and
Right.
this week we're actually launching a toolkit for businesses. I think it's at the printer right now. And it will include decals and signs, and it's a way for businesses to show the efforts that they're taking to keep customers and employees safe. And it's also signage that asks of customers how they need to show up. So wearing masks, socially distancing, and that they need to be aware of the fact that some businesses have limitations on capacity. They're included in that. There's also a front door sign that says mask required here, and they can include whether or not they have masks available inside, or if they expect people to bring them themselves. We're also talking with Whatcom Unified Command about a potential for additional capacity to give out more disposable masks, so we can make sure that businesses have the tools that they need in order to be able to work with customers and make sure that they can be compliant with the mask directive, or excuse me, the mask mandate.
Okay.
Okay.
Oh, sorry. Were you finished?
Oh, I was. I just heard some background noise, and I saw someone mute their phone. So I think we're okay.
So finally, I was going to say, you said that complaints are going to the state, but have you heard personally any pushback, and do you know of any enforcement action that's been taken locally?
We have heard there's lots of opinions about masks, and there's lots of concerns about masks, and Whatcom County is a microcosm of a much larger debate about wearing masks, and we recognize that. But from a public health perspective, we know that masks are effective, and you know what? They're kind of a pain, and we recognize that. But this is something, and this is a tool that can help save lives, that can help save our neighbors, friends, people we don't even know from this virus. And so we continue to push positive messages, not shaming messages, because we know that not only doesn't work, but it isn't the compassionate way we want to be all in this together. So there are lots of opinions about this, but from a public health perspective, we strongly believe that it is an important tool of the very few in our toolbox to slow the spread of this disease.
Okay. Hey, thank you.
Yeah.
Our next question is from Key Relia with the Bellingham Herald. Key, go ahead.
Thank you. Erica, you indicated that, or you said that there, in terms of supplies and the ability to test, we have that ability here in Whatcom County. And I know that for a while, the health department has been saying, if you're sick, you should be able, you can get tested. So what is the disconnect with the public if they don't think they can get tested locally? Because I know that I got some data from Skagit, and a pretty good chunk of their testing down there is from Whatcom County residents. So what is the disconnect? Thank you.
Sure. So I think for starters, and I'm glad you're all here because I think there's work we could do to better communicate and articulate to our residents what is available to them in terms of testing. And I know that's been a gap for some folks, that they've heard they can get tested in Skagit, and that's easy and 30 minutes south. So they do that instead of talking to their doctor or talking to the health department. So communication is something that we want to continue to do and make sure that resources are available and well articulated to people. So that's been a gap and a barrier for us.
Our next question is from Dave Rosbach with the Bellingham Herald. Dave, go ahead.
Hi, Erica. Appreciate you taking the time. Your last section where you were talking about the most recent cases in the community, there were a lot of numbers there. I'm just wondering if you could run through those again, just to make sure I got those numbers correct.
You bet.
In particular with the outbreaks.
Okay, you bet. So since the beginning of June, there have been 20 outbreaks that meet the Department of Health definition of an outbreak, which is 2 cases in 2 weeks, or at a long-term care or congregate facility, 1 case.
Perfect. Thank you so much.
Yeah, you're welcome.
Next question is from Ron Judd with the Seattle Times. Ron, go ahead.
Hi, good morning. Erica, earlier you mentioned the data, the charts put out about the mask question and mask wearing effectiveness, and setting aside the argument of whether they're effective, which they seem to definitely be. Were you saying that the number in the one chart about mask use that projected cases into the fall, were those numbers incorrect?
No, those numbers are, and is the case with all models, those numbers are estimates. We couldn't tell you, we do not have enough data or historical information to be able to say on November 6th of this year, there will be this many cases if we have this rate of compliance with masks. So it is an estimate, and it's our best guess.
The estimate seems very high, 1,900 cases per day in a county that has had only 630 to date over a 4-month period with no mask use at all virtually. Does that just seem kind of off the charts to you? I mean, I know it raised a lot of eyebrows among people in the public seeing that number, even on the model.
Well, I think it's important to note. I think it's important to note that much of the last 5 months, we've had very, very limited exposures to each other. We saw the curve really, really shift, and we're now back in the acceleration phase. And so it is concerning. And like I said, gosh, if one person is infecting or is exposing 20 to 50 people, and they're going out and doing that for 3 days in a row when they're symptomatic or when they're pre-symptomatic, those numbers add up really fast.
So you think that number is a reasonable estimate then?
I think it's a demonstration of how bad this could get if we don't use the tools available to us, which are very few and limited.
Okay, so my follow-up question on that then would be, you had somewhere north of 100 cases a week ago or so when this spiked, and I think you were quoted as saying that the contact tracing system that the county currently has was overwhelmed by that number. That was 100 and some people in a week's period. If that's the case, how are we going to be prepared to do contact tracing for 1,900 a day come fall in a effort that right now appears to just include volunteers and kind of a less than robust team of people who I'm sure are working really hard. But how do you square those things in your mind, reacting to that kind of numbers in the future?
Yeah. There isn't a single county in our country that is prepared for our worst case scenario. There's not a single county, because it also means that our hospitalizations are off the charts. It also means, there aren't any counties that can possibly prepare with the resources that we have available, with the lack of ability to draw from other counties for our services. I mean, that's part of the challenge in this, is if we had a crisis in Whatcom County, in other scenarios, we could ask people from Skagit County, from King County, from other places. We all are having to rely on our own resources, and there's not a single county that could effectively manage our worst case scenario. And that's why our national public health experts, that's why our state public health experts, and that's why our local public health experts are pleading with our community to use the tools available to us and prevent a worst case scenario.
Right, understood. So related to that, and I don't want to hog the time here, but one more follow-up. You mentioned that the mask wearing and the social distancing and hygiene are the only tools available to the public, but it seems like another one is public information. And you guys have had, by your acknowledgement, 20 outbreaks since beginning of June, and I don't recall that many, if any of those, actually identified the source of the outbreak. And I hear, as a reporter, from readers who are frustrated with a lack of information about that. I mean, you were quoted in the paper this week as saying that people from some of these large groups went back to their jobs and places of work and infected customers. And don't the customers of these businesses have a right to know that these outbreaks have taken place so they can do their part in avoiding those places and staying away from making it worse?
So this is the role of the case and contact investigations. And I want to be clear that when we have a case identified at a workplace, we immediately make contact with the employer. We ask them for a line list of everyone that may have been exposed. So coworkers, were they a delivery driver and drive with someone else in a car and not wear a mask? Did they eat lunch with a coworker? And presumably these things aren't happening because in phase 2, we're not at that point where these things can happen and everyone should be wearing a mask. But we do ask them, what are the close contacts? Who maybe have they exposed? And then we do quick work of contacting all of those people that may have been exposed and making sure that they are able to get tested, being able to quarantine effectively so we can control it. We would only in a couple of scenarios reveal the identity of employers. And those scenarios are: one, the employer decides that they want to share that information with the public. The second would be if we believe that there is a community risk. So for example, there is an employer, and I'm not going to share which one it is, but there is an employer that has a positive case, and the only other positive case after everyone else was tested was the roommate of that employer, and they both work at the same employer. There is no community risk of those two people effectively quarantining. So there wouldn't be a reason for us to share that information with the public because we don't believe that there's a community risk there. The only other scenario where we might have to reveal the name of an employer is if that employer does not cooperate with us, if they do not provide us with a line list, if they do not make sure that their staff are and working with us to isolate and quarantine effectively, then there is a risk that there could be community spread because we don't have the information to be able to assess that. So we may reveal that information, and we would if we have concerns about community spread.
So what is the public health benefit of not revealing that information?
The public health benefit is we have cooperation from employees and from the employer to work and to be partners in the resolution of these cases.
So if the employer is, just to use an example, some sort of a retail outlet or establishment, how do you know, and your contract tracers know, everybody that's been in contact with that employee without the public having that knowledge to come forward on their own, like they would in a measles outbreak or some other thing?
We have a methodology, and the work that we do determines whether or not there's a risk of spread. If you walk into a retail store and you are not 6 feet away from the person that works there, and you're there for 2 or 3 minutes, there is not a risk of spread there. So we really do our due diligence in determining whether or not that type of business is a high risk business for spread, and whether or not there is spread among the community. And at this point, the businesses that we're working with, there isn't that risk. There just isn't that risk.
So this is a policy decision, right? This is not consistent in other counties in the state who have, as a routine matter, identified employers, and actually to the level of individuals. Is this just a policy among Whatcom County Health, and what guides that?
Revealing individuals would be a HIPAA violation against the law. So we would never, ever reveal individuals.
Yakima, Benton counties are doing it.
Well, I can't speak for them, but we would not reveal individual names unless they authorized it and did it themselves in partnership.
Yeah, I don't think people
just like we do with businesses.
but I think people, from the feedback I get from readers, do expect groups, institutions, employers, schools, things like that. And I think that there's a real frustration and misunderstanding about why it is that you folks are leaving it up to those people to make that decision when the law is on your side to compel them. You have the right to do that, right? You have the legal right to identify these outbreak sources, correct?
And we would do so if we believe that there's a risk of community spread.
Okay, thanks.
As a follow-up, I'm happy to send you our decision matrix on this, and I could connect you with one of our staff that works in this area with businesses, and could talk with you through a bit more in detail about how that process works and how they make that determination.
That would be great. Thank you.
Okay. Melissa, can you remind me?
We'll follow up with you later, Ron. I want to make sure we get on to some other questions, so we'll move on to Oliver Lazenby with the Northern Light. Oliver, go ahead.
Oh, hi, thank you. Erica, you told County Council last week, I think, that certain providers were scheduling people up to, I think, 2 weeks out for testing. And today you said that testing could be scheduled within 24 hours. What happened in the past week to change that situation?
Well, what we learned, and I want to be clear, when the County Council raised this issue with me, we had just learned about it within the last few hours. We did get that report as well, but I didn't have any background or context in order to be able to answer it. And what we are finding is, for example, someone who wants to travel to Alaska, who doesn't have any imminent risk, or someone who is planning to get on a fishing vessel in a few weeks, they could schedule out a test, because if they don't have symptoms already, if it's a return to work kind of situation, or they'd like to travel up to Alaska, they can schedule that appointment out in advance. CMAR did experience high volume of need when they first opened, because it was a new option. Within a day, we worked with Northwest Labs to open additional slots, and we've been communicating with other providers as well. So that was one scenario where we found that that particular provider had people scheduled out a ways, but upon further sort of looking at it, it was more for routine kind of testing rather than imminent testing or testing based on symptoms or close contact. But for people who have a medical necessity to be tested, like people who have symptoms or close contact, we can get them in within 24 hours in our work with Northwest Labs.
And is that a recent development. This is an anecdote, but I was a contact of someone who tested positive, and I could not be tested within 24 hours. That was early last week.
Mm. Okay. And you know, I'm sure we could talk offline about your experience as well, but once we have a nurse consult with someone who's a close contact or a case, we work with Northwest Labs to get them in either that day or the next day. So
And it was
not
close.
sure.
I could be an outlier, but I wonder if the fact that people need a referral from the health department or a doctor, it seems like that imposes significantly extra time to the process, and I think that's why people instead drive to Skagit County. Is that the fact that people need a doctor referral and the time that comes along with that, is that a problem that that you would like to see go away? Is there anyone working on that?
You know, we have a standing order, which essentially means that our health officer has authorized our nurses to have a conversation with individuals to identify whether or not there's a medical necessity for them to get a test, and there are options for other practices to have a standing order like that as well, which would eliminate some of the steps. And we're working with providers to do that. We're also looking at models where some of these things could happen concurrently, where it wouldn't be step 1, step 2, step 3, but they could happen concurrently. So I think there's a lot more to come on this. We're really having good success with working with partners. And certainly everyone's goal is to make sure that everyone who needs a test is able to get one as soon as possible.
Thank you.
Yeah.
Next question is from Robert Mittendorf with the Herald. Robert, go ahead.
Hi. Yes, last week, Erica, you talked to the county council. Someone asked you if you were worried about a return to phase 1, and you laid out some things that would have to happen for that. It doesn't look like those are happening. It looks like the infections, even though we're seeing more, there are not requiring as much hospitalization. Do you think we're out of the woods there? Are you worried about a possible return?
You know, I think the concept we've all been increasingly comfortable or uncomfortable with, which is our reality, is uncertainty. And at this point, we are seeing most of our metrics staying pretty stable. The ones that, of course, like I said last week, hospitalizations, deaths, and running out of capacity in our isolation and quarantine facilities, those would be big concerns for the state, and certainly more conversation. And we're seeing this happening in other parts of the country. And I'll just add that the state is coming tomorrow to talk to our Whatcom Unified Command, who is responsible for the isolation and quarantine facility, but also working on medical surge capacity and what that would look like, and developing partnerships with providers in the case that we don't have capacity at Peace Health. We have to plan for everything, including moving backwards. We hope that won't have to happen. That would be really devastating to our economy. But if we did do that, it would mean that COVID is also devastating to our community. So you know, it's just kind of continuing to track and doing the work that we're doing to try to make sure that we're containing this as much as possible.
Hey, thanks.
Yeah.
Next question is from Key Riley with the Herald. Key, go ahead.
Thank you. Erica, this is a two-parter. One, do you think we are on the other side at this point of those outbreaks? It looks like the numbers are tapering off, but they're still there. So I wanted to get a clear sense of that. And then actually, I'll wait until you answer that, and then I'll ask my second question. Thank you.
Okay. It's hard to know. A lot of this is out of our control and relies on community behavior. And so I could say right now that the rates are going down, but we've also heard about large group gatherings last weekend. So we will see those in the next week. We also know that in 3 days, we'll have a major holiday where people like to gather. And so it really depends on the behavior of our community members. I know that this week we've been pushing the, celebrate small, celebrate safe. But we are finding more and more that that's challenging for a lot of our community members to do. And we need to do more work to make sure that folks understand the implications of that. And I think actually the health officer in Snohomish said it best, is that party or social gathering worth quarantining for 2 weeks after? And if it's not, then it's probably not worth going. So, a lot of this really depends on the behaviors that we see in our community.
Thank you. And related to gatherings, in a way, this is the second of my question. So in looking at the most recent risk assessment dashboard, it showed that Whatcom was missing the target rate of more than 50 individuals tested for each new confirmed case the past week, and we were down to 19.5. So I'm trying to figure out what your sense is, what is the cause of that? Why aren't people getting tested? Thank you.
Yeah. I just for a bit of context, there's been a lot of focus on this metric. And by the way, 2 metrics are essentially the same thing. They're 2 out of the 5. The 2 testing metrics are essentially telling us exactly the same thing, just in 2 different ways. So if we miss one, we miss the other, and vice versa. So it's a little bit deceiving that way. And I can tell you for a bit of context that there are only 12 counties out of all the counties in Washington state that are meeting this metric. And more significantly, 9 of those 12 counties have either 0 cases or 0.1 or 0.3. All 9 of those have less than 1 case per day. So this is clearly a problem that we have statewide. This is not a Whatcom County challenge. This is a statewide challenge that really the bulk of the counties that are successful in this metric are the ones that have so few cases that even if they did 20 tests a day, they would be meeting that metric. So, so just for a bit of context around that, because I think that's important. We also, we're identifying a lot of people that we're testing through our case and contact investigations. So we do believe that in that way we've been successful, because we're getting people in to get tested that are actually at risk of the disease, rather than testing lots of people who have no symptoms, who have no contact with anyone who has symptoms or is a confirmed case. So, obviously there's more we can do to increase the number of tests, but we also want to make sure that the testing we're doing is targeted to people that are actually at risk for the disease. So I think it's an and situation. We can do more, and we're also identifying a lot of people who actually are at risk.
I'm sorry, a quick follow-up to that. Related to that metric, Erica, and I think you're referencing it in a way, Skagit is meeting that metric. So that So I wonder, in a way, if this is one of the things you are considering as the health department in terms of also setting up a wider drive-through testing where people can come and without a doctor's order. I know you referenced that Greg Stern had a standing order, but I just want to make sure at least to ask you directly if you are considering doing what Skagit has done as well. Thank you.
Sure. We're considering, so I think what Skagit is doing is one model for removing barriers for people to get tested. And we're really committed to removing barriers for people to get tested. And whether that looks like more testing from providers, that's lower barrier, whether that looks like one centralized location like Skagit, that's one option. There are lots of different ways that we can make sure that people have lower barriers to get tested. And the Skagit model is just one of them, but we are considering lots of different options, including the Skagit model.
All right, I want to make sure that we get a chance to get to some folks who haven't asked questions. I do see a question from Ron Judd about testing. Ron, we'll go ahead and follow up with you offline about those test results. I believe we may need to get in touch with our disease investigators to get a clear answer on the turnaround time there. Our next question is from Chris Halterman. Chris asks, what's the hospitalization increase, ICU increase, and death rate versus the last meeting? And what's the change in the percentages? Have they gone up or down? Erica, can you speak to that question?
I can. Let me look up the, I can look up the data dashboard right now and tell you. Let's see here. Okay, where are we? Okay, license beds. Okay, just a second here. The current percentage of licensed bed occupied by patients is meeting the metric of under 80%. It's at 71.4%. Melissa, would you mind including links to the COVID-19 risk assessment dashboard and the COVID-19 data dashboard? These are both really great tools to see this information. The death rate, we've experienced 3 deaths in the last, I believe, just over a month, and I don't think that's changed since last week. What is the other question? Let's see. ICU rates. I don't have that level of detail. And just to be clear too, the percent of licensed beds occupied by patients, that's all patients for all reasons. Not just COVID. So that would be if someone had a surgery, or if they had an immediate crisis, or they had a baby, or a number of other reasons why they may be in the hospital. So that doesn't have COVID specific hospitalization data. I'm just trying to see if there's anything else, but I think the risk assessment dashboard should be able to answer all of your questions. Thanks for including that, Melissa.
Yeah, absolutely. I did just drop links to both the Washington State risk assessment dashboard, that includes those metrics that Erica has been referencing, and also a link to Whatcom County's data dashboard as well. It looks like our next question is from Julie Shirley with the Herald. Julie, go ahead and ask your question.
Thank you. Hey, let me follow up just real quick on that last question about hospitalizations. Since the over, those numbers have been 71.4 and 0 and have not moved, yet we know there have been cases at the hospital. Do you know why those aren't working?
You know what, we'll have to follow up with Peace Health on that. Okay. They're reporting in that data, so we'd have to follow up.
So those numbers have not changed since June 8th.
Okay.
There's supposed to be a state outage on the June 25th. But after that, the numbers still have not changed.
Oh, you know what? Yes, look at that. Yes, we'll follow up with the hospital.
Okay, thank you. So on to the question really wanted to know is the quarantine facility you'd set up. There was the one hotel that was in operation, the old Motel 6, and then there was another one that you were setting up. And then when you have numbers now of how many people have been at either of them and sort of how many bed nights that has been.
We'd have to get that data for you. Gosh, I'm not
Okay,
sure.
I asked last press conference and we didn't get it. So I was hoping we could actually get that to date.
Julie, this is Melissa. I wasn't at the last conference, but I can certainly follow up with you and make sure that we get you those numbers.
Okay, thank you.
Yeah, absolutely. We are coming up on the 12 o'clock hour. We're going to go ahead and have one more question. It looks like that's from Robert Mittendorf with the Herald. Robert, go ahead.
Hey, thanks very much. I think I asked this question at the last press conference, and I was wondering if there was any change. I had asked about a local R0 or transmission number. Do you guys still not have that locally, or do we know something more about that now?
Robert, yeah, we did talk a little bit about that question. Again, this is Melissa. We still are not tracking R0 as a local number. We are referring to the state's Western R0s. Yeah, and in our modeling reports, we could take a look at that again as well, but that's sort of looking at what those R values, how they might change over time. So we aren't tracking the current value.
Okay. Thank you. I appreciate it.
Okay. And I do see, just as a follow-up, Julie, you asked about the second facility. We have not yet used the second facility and have an arrangement with them where we pay for the beds that we use. So that is available to us. I believe it's an additional 51 beds for additional capacity if we need it. But we have not been at capacity of our primary isolation and quarantine facility.
Thank you.
Yeah.
Okay, and with that, we're going to go ahead and end the conference. Thanks again to everyone who attended. And as a reminder, a recording of this will be available later today online. Enjoy the rest of your day.